This is the eHealth Radio Network, your source for health advice on demand. And now your host, Eric Michaels.
Thanks for joining us once again here on the eHealth Radio Network. This is your host, Eric Michaels. eHealth Radio gives you the most current health information, news, and advice featuring some of the leading innovators in healthcare and wellness who are changing healthcare as we know it. For more eHealth Radio reports, we invite you to visit our main radio channel site at eHealthRadioNetwork.com. Today on the program, we're speaking with Dr. Robert L. Murray, the Chief Medical Officer at NextGen Healthcare, an award-winning provider of innovative cloud-based healthcare technology solutions for over 100,000 ambulatory providers. He's also a board-certified practicing family physician. And Dr. Murray, thanks for joining us here today.
Oh, thank you very much for having me, Eric.
Hey, you're more than welcome, and thanks for your time as well. So for starters, describe what doctors are facing today in terms of information overload in this concept of, if you will, overtech.
Sure. Yeah, and I don't know if a lot of patients really appreciate this, but there's a lot going on in the doctor's offices these days. There's a lot of technology. Most doctors' offices are computerized now. Those computers don't always do a great job of talking to one another. And there's a lot of kind of demands on the doctors and the clinicians' time. And so this contributes to this feeling that the doctors are always racing. Patients may experience this as the doctor's not spending very much time with me. And because of all of this technology, this kind of concept of over tech, comes into people's thinking that there's just, wait, is all this technology really helping us, or is there just kind of too much of it? So there's a lot of challenges in the doctors' practices these days, at least for a lot of them.
Yeah, we've certainly been hearing the chatter on this end for sure. To lead into the next question, how did this all come about, and what approaches have been attempted to correct the problem?
It's a good question. There's, a couple of threads have kind of led to the situation where we are today. So the first is just the computer systems themselves. They're typically called electronic medical records or electronic health records, EMRs, EHRs. And they've been around for a long time, but they were kind of originally just computerized replacements of the paper that the doctors used to keep track of patient charts. But those charts have always been used by more than just the doctor. Whoever the insurance company is, has access to the chart. Patients had access to their charts. The government sometimes wants the charts to do certain things. And as those paper records transition to computers, all of those demands, in fact, increased because the insurance companies or whoever realized, wait a second, all this stuff is computerized now. In that case, we can make the doctor make sure that they ask this question, or make the clinical staff make sure that they do these things, and we're gonna double check that they did that by looking in the computer record. So as the computers kind of replaced paper, they weren't designed from the ground up by people who actually care for patients. There was a lot more kind of administrative thoughts into the design of those systems. Now, obviously, we at NextGen Healthcare, we try to simplify this and try to make computer systems and records that are designed, by clinicians to be used by them, and kind of automatically take care of a lot of those administrative tasks. So that's the root of a lot of it. But the other thing to realize is just that medicine is unique in some ways, because it's quite regulated, right? There's a lot of laws around privacy and around medical boards. There's a lot of kind of government entities that have some kind of say over healthcare, and they all want things to be done a certain way. And they have the interests of the public and the patients at heart as they're doing this. But they also play into this kind of administrative burden that physicians are feeling. You toss in there that the insurance companies are, for most doctors, they're kind of driving them to try to see as many patients as possible. The way that the physicians are paid, very few patients pay the doctor directly. You might pay a copay, right? But you don't pay the whole bill. It's usually the payer that does that. So the payer has a lot of say as to kind of how the doctor's practice works, even if the doctor might not like it that way. And then finally, of course, COVID, really changed the stress level for a lot of healthcare providers. Lots of people are affected, lots of patients are affected, everyone is still being affected. But in particular, healthcare personnel were really very affected, very stressed by the COVID epidemic, which we're just hopefully starting to turn the corner on now. So in terms of attempts to correct it, that it is our job at NextGen and the other companies involved in this industry to try to, produce technology that lowers that administrative burden, that kind of turns down the noise that the doctors are hearing from their computers and from all the different systems that may not be doing a good job of talking well to one another. And there are things that the practices and the physicians can do as well. And then finally, we can also talk about things that patients can do to help.
Yeah, certainly appreciate your feedback and info and details there. Now, what would be your advice to those trying to combat this overload and turn down the noise, which is so important?
Sure. I mean, if I'm speaking to practices and physicians and clinicians using this system, and I'm mostly talking about doctors' offices, so ambulatory practices as we call them, not so much in the hospitals, although a lot of what I'm saying would be true for the hospitals as well. But anyway, speaking to those folks, there's a couple things that they can do to help with this over tech and this burden. The first would be to try to select the right system, right? I mean, obviously I have a biased opinion there, but you want to try to pick a system that does as much as it can, because a lot of the friction about getting information from the patient in person, but also that the patient was seen in the hospital last week. Well, that's a different computer system, and then you have records from their previous doctor, and that's a different computer system, or maybe it wasn't even computerized at all. You want to try to get a system in your practice that can handle all of those types of information. And when possible, that brings that information automatically to you, and even organizes it for you inside the computer. I think the other big piece of this that practices can do is, from my position, I'm always a little amazed about how practices may not realize the importance of really understanding the computer system, the EMR that they use every day. I mean, whether you like computers or don't like computers, you're as the doctor, you're using this thing 6, 8, 10, 12, whatever hours a day. You should really do everything you can to understand how this system works, how you can be efficient in it. Talk to your colleagues that use it, talk to the vendor, go to conferences that feature this system, and really learn as much about it, because like it or hate it, the more you know about it, the more efficient you can use it, and you'll hopefully find it less of a burden, and more of a help in doing your job, taking care of patients.
Yeah, that certainly is what it's all about, and really appreciate all the info shared so far today. We're speaking with Dr. Robert L. Murray, the Chief Medical Officer at NextGen Healthcare, an award-winning provider of innovative cloud-based healthcare technology solutions for over 100,000 ambulatory providers here on eHealth Radio's Healthcare and Technology channels, a part of the eHealth Radio Network. Now, continuing on, how can technology be harnessed in a useful way?
There's lots of great tech that can come to play here. So, obviously the electronic health record itself, should be well designed by people that are intending to use it to take care of patients across a wide variety of specialties. But there's lots of other stuff that can help here. So this voice technology, for instance, that we're all familiar with Siri or Echo, that can play a massive difference within a doctor's offices. And so we encourage providers to look for opportunities to use their voice to do their documentation. There's also emerging trends of having one of those devices. It's typically part of your EHR or very tightly connected to your computer system, but having it listen to the conversation that's happening between the patient and the provider in the room, and then use that information to help the doctor do the charting or order the tests that were spoken about, or that sort of thing. Now, that's typically not recorded, it's not part of the chart, but it can be very helpful to use that kind of voice to text technology to help the doctors do their job. The other kind of big class of technology that can really help, that we're also pushing very highly, is mobile technology, right? So the ability to communicate easily with the doctor's office, typically not via text message, because that's not considered private, and a lot of medical communications are protected by laws. They have to be private. But to be able to easily communicate through a patient portal, and from the practices side, to be able to get those messages and respond to those messages, and have access to the patient's records and the ability to do things while you're not necessarily using the computer itself in the office, but using your smartphone. Very, very handy for the providers who are, they have lives outside of the office. They want to get their office work done and then, go to their kids', soccer game, hockey game, be part of the family. It's nice though, if because they're carrying their smartphone around with them all the time, if they need to, they can quickly, check in with the computer records, or check in with their patient charts, do something very quick, like maybe prescribe a medicine, talk to the patient over the phone, use their voice to document that encounter, and then get back to whatever it was on their personal time they were doing. So there's lots of ways that technology can help, as well as being the center of some frustration for a fair number of providers.
Now, lastly, Dr. Murray, as patients, what can we all do to get the best healthcare outcomes? That's certainly what everyone's after.
That's a great question, Eric. So I have kind of three recommendations that I would make for all of us, because we're all patients, even those of us that are doctors. So this first one, it's really important that you try to take an active part in your own care. And if you picture it from the doctor's side of things, especially if you are somewhat complicated medically, maybe you see a number of doctors or you have a number of medical conditions, I recommend that you try to keep a summary, a very short summary of the care that you are receiving from these different places. A very effective way to do this, even though we sell computers for a living, is on a piece of paper. Just every time you see a doctor or go to the emergency room or urgent care of the hospital, just write down the date, who you saw, and what happened, very, very briefly. Because if you then share that piece of paper, or, obviously you can keep it on a computer and print it out, but if you share that with the next doctor that you see, then that can be extremely helpful for them to just know all of the different places and dates that care happened. Because if they need to get those records, if they're not available automatically in their computers, they can get them. And also, your summary of what happened to you is very helpful to them. And it can be helpful to you as a patient as well. I went to the doctor, I didn't get an antibiotic, he told me, over-the-counter treatment. Or I went to the hospital, I was having abdominal pain, kept me overnight 2 days, a bunch of tests were done, they told me to follow up, blah, blah, blah. That kind of summary can also be helpful for you in keeping track of your own care. So that's number one. I think number two, I would say, would be to use the technologies that are emerging to communicate with your doctor's practices. Use them wisely. I think you need to picture that the doctor's office is getting lots and lots of information about you, about the thousands of other patients that they take care of. And so if you're going to be messaging them, you need to picture what that message is going to be like from their end. And if it's going to take more than a minute or two for them to read your message, figure out what the answer is, and reply back to you in those messaging, then it's probably better if you actually request a visit instead. And maybe that's a virtual visit. Hopefully your doctor offers virtual visits. Obviously, NextGen Healthcare, we support that sort of thing as well. But if it takes more than a minute or two, then there's so much pressure on doctors. You're not going to get as good of an answer as if you scheduled some real one-on-one time to talk to the provider about that answer. So that's another recommendation. And my third recommendation is just that you have a primary care provider. Everybody should have a primary care provider, somebody that's at the center of their medical life that can help them coordinate the activities of whoever else they're seeing, and make sure that they're getting the best advice, getting the best health care that they can.
Well, Dr. Murray, we want to thank you for what you do on behalf of NextGen Healthcare and for joining us here today. If listeners wanted to tap into NextGen Healthcare, where's the best place online to not only get more details, but to be in contact accordingly?
Well, it's probably easiest on our website. Just go to www.nextgen.com, and then you can poke around there. But yeah, thanks, Eric, for having me. Thanks for giving me the opportunity. And everybody out there, just be an advocate for your own health, take ownership, and help turn down that noise a little bit. Thanks.
Great way to conclude here today. Again, folks, it is nextgen.com. Dr. Murray, all the best, and thanks for joining us here today on the Health Radio.
You too. Bye-bye.
Again, we have been speaking with Dr. Robert L. Murray, the Chief Medical Officer at NextGen Healthcare, an award-winning provider of innovative cloud-based healthcare technology solutions for over 100,000 ambulatory providers. And again, for all the details, visit nextgen.com. And again, this has been your host, Eric Michaels, and we do thank you for your continued support of the eHealth Radio Network. Join us again soon for another episode that will help further expand your knowledge on those things that are important to your health and wellness. For more eHealth Radio reports, we invite you to visit our main radio channel site at eHealthRadioNetwork.com. And as always, we do thank you for tuning in.
Thanks for tuning in to the eHealth Radio Network. For more information or to subscribe to this podcast, visit eHealthRadioNetwork.com.